a we thing.
It's a we thing.
The thoughts, ideas, and concepts shared in this podcast are based on the lived experiences of the host and their guests. Validation is incumbent upon the listeners. Hello, my name is Anna Huff Davis.
And my name is Naomi Cottoms, and we're your host for today.
The Arkansas Community Health Workers Association is governed by a board of directors. I would like to present this slate of directors to you at this moment. We have Ms. Mary Risper. Ms. Risper is an employee of the Helena Regional Medical Center in Helena, Arkansas. She has been a community health worker since 2005. She has been very integral in working with patients in the Lee and Phillips County area, but also across the state of Arkansas, and I'm sure pretty much very well beyond the state of Arkansas. We also have Mrs. Wanda Miller. Ms. Miller is an employee and works with the UAMS Center for Racial, Health, and Social Justice. She has been a community health worker since 2009, and she is the treasurer of the association. We have Ms. Sandra Cooper. Ms. Cooper has been a community health worker since 2015. She serves as the secretary of the board, and she also works for the University of Arkansas for Medical Sciences Center for Racial, Health, and Social Justice. We have Ms. Melanie Joyner. Ms. Joyner is currently a community health advocate at the University of Arkansas for Medical Sciences. She works with patients to navigate services and resources. She has been a community health worker since 2016. Then we have Ms. Sarah Moore. Ms. Moore is the Assistant Director of Programs at the Northwest Arkansas campus of the University of Arkansas for Medical Sciences. She trains, she supervises, and she also assists with development of community health workers in the state of Arkansas. 4 of our board members have been trained as community health workers. 2 have received training that will assist them in pursuing certification, and 2 have received training in the core competencies as community health workers. So I share that with you to let you know that all of our community health workers have been trained in the role and the responsibilities as community health workers. Then we have, as an ad hoc member or our past chair, our founding chair, Ms. Naomi Cottoms. Ms. Cottoms, as you all know by now, has been very integral in the development of the association and the training and development of community health workers, stateside and also nationally. Then I serve as the chair of the association, and I am an employee of the University of Arkansas for Medical Sciences, the College of Public Health, as a community liaison to the dean, and also I work with the community engagement team of the Translational Research Institute.
We're excited, really excited, because the Arkansas Community Health Workers Association has now been able to identify and began working with an executive director. It is one of the most exciting things we've done. We're grateful, and we want to share with you a little about the person that's coming to assist us.
Yes, we are very excited to bring aboard Dr. Judy Pile. Dr. Pile is coming to us from Baptist Health, where she has been since 2007. In that time, she led the college through its transition to become a degree-granting institution. She opened 3 new programs of study. She was a champion for degree advancement and secured over 200-plus partnerships and affiliations to serve currently enrolled students and graduates at Baptist Health. During her tenure, Judy also became involved in Baptist Health preschool operations, and she was a part of the leadership development activities and served as chair of the Baptist Health Clinical Pastoral Education Professional Advisory Group. Please join us in welcoming Dr. Judy Pile to the Arkansas Community Health Worker Association.
Ooh, we're excited.
We are so excited, so excited.
While Dr. Pile came to us with wonderful credentials, a real understanding about who we as community health workers are, the kind of work that we do, she began her first week of trying to learn more about who we are, where we are, what we do, and how we do it. She made a visit to the Delta region of the state of Arkansas. She came all the way to Helena, West Helena, and Marvel, Arkansas. Phillips County, Arkansas, one of the poorest areas in the state, not just in the state of Arkansas, but in the nation. And she came down to meet us, to greet us, to learn from us, to better understand the culture of where we are and how we work, to understand the work that we do and have done in years past. It was a really good day. She met mayors from the city. She visited health clinics. She visited the Delta Cultural Center. She visited Boys, Girls, Adults Community Center, a mainstay institution in Phillips County. She visited Tri-County Rural Health Network, an organization that has been here for a while, aiding in the training and development of community health workers. And we're just excited to have had the opportunity to spend time with her. We're really proud of our new executive director, Dr. Judy Pile.
Excited that our board was very fortunate in their endeavors to bring on an executive director and placed her and has hired her, and now we are well on our way.
Well, I'm just excited like you that we're well on our way. She comes with vision, and like I said earlier, she actually understands who we are. And what impressed me was her ability to relate to us, her ability to understand when we shared information, her willingness to learn our culture and the way we do our work. I thought it was just phenomenal when she came into our community with open arms. She actually brought a gift to our organization to say thank you for hosting her to our community, and she has promised to return. And Boys, Girls, Adults, and Community Development Centers will be having its annual banquet, and so Dr. Pile is even trying to figure out how she can come back and be supportive of that activity. That takes a lot. That's really being willing to give. So I'm excited. I'm looking forward to her leadership, and I can't wait to see what's going to happen, because I know that the Arkansas Community Health Workers Association is about to move. It's been a movement since the beginning, and I know that it's about to move. It being a movement just takes me back to something we've shared with people before. It takes me back to wanting to make sure that everybody understands that this is a nonprofit organization, and it's been around as a nonprofit since 2013. But we started working long before 2013. I'm going to say like in 2009 by engaging community health workers. We started as far back as the early 2000s of learning about other associations throughout the nation, what other community health workers were doing and how they did their work. And then we began to talk about what we wanted to do, talk about our needs, and we created the Arkansas Community Health Workers Association. Once our association was developed or almost ready for development, we realized that we needed to partner with some people other than just community health workers. And so we started to build allies. And one of our strongest allies has been members from the Arkansas Department of Health, who continue to work with us today. They were with us in the beginning, and they continue to be with us today. And so I, again, remain excited, looking forward to what's going to happen. I see some change already coming with our certification program, how people are beginning to respect who we are and treat us like a profession. And so it's just wonderful that ARCHWA is on the move. So when we say this is a movement, it's not a joke. It's literal. ARCHWA is on the move.
And as chair of the Arkansas Community Health Worker Association, please join me once again in welcoming Dr. Pile to our ranks. We are so fortunate to have found her, and she found us. And so once again, welcome, 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 Dr. Pile. Until we meet again, this is Anna Huff Davis.
and Naomi Cottoms. It's a wee thing.
It's a wee thing.